Do anticholinergic drugs interact with antipsychotics? If you are curious about how different medications work together, you are in the right place. Today, we will discuss the interaction between anticholinergic drugs and antipsychotics, especially in the context of treating schizophrenia. Anticholinergic drugs are often prescribed alongside antipsychotics to help manage extrapyramidal side effects. These side effects can include tremors, rigidity, and restlessness, which are common with many antipsychotic medications. Anticholinergics work by blocking acetylcholine, a neurotransmitter that plays a role in muscle control. This action helps reduce those uncomfortable movement disorders. However, there are important considerations to keep in mind. Long-term use of anticholinergic drugs with antipsychotics is generally not recommended in schizophrenia treatment guidelines. This is because these drugs can worsen cognitive impairment, which is already a significant issue for many individuals with schizophrenia. Cognitive problems can include difficulties with memory, attention, and executive function. These issues can lead to challenges in daily life and overall quality of life. In addition to cognitive effects, anticholinergics can cause peripheral side effects. These may include dry mouth, constipation, and urinary disturbances. They can also worsen tautive dyskinesia, a late-onset movement disorder, and increase the risk of delirium, particularly in vulnerable patients. Despite these risks, anticholinergics are still frequently prescribed with antipsychotics. Sometimes, they are given as a preventive measure or for extended periods, which goes against current expert recommendations. This gap between guidelines and actual clinical practice is observed in many places around the world. In clinical settings, anticholinergics should be used carefully. They are typically reserved for short-term treatment of significant or acute extrapyramidal side effects when adjusting the antipsychotic dosage or switching medications is not an option. The aim is to minimize exposure to anticholinergic drugs to reduce cognitive and other adverse effects. In summary, anticholinergic drugs do interact with antipsychotics in the treatment of schizophrenia. They can help manage certain side effects, but may worsen cognitive function and lead to other side effects. Careful management is essential to balance the benefits and risks for patients receiving antipsychotic therapy.